National news of a bacterial outbreak in California is leading local patients to cancel colonoscopy appointments. 2 patients died in the U.C.L.A. outbreak. More than 100 others have been exposed to an antibiotic-resistant bacteria. Now, Pensacola specialist says the vague reports about the incident are causing some of his patients to worry and avoid crucial exams. Channel 3's Catherine Daniel has more.
Gastroenterologist Patrick Reilly says he is worried about an interruption in patient care.
There are patients that are canceling. There is obviously a misunderstanding.
Reilly says national news articles about the U.C.L.A. outbreak were brief and did not make a distinction between the types of scopes used and which procedures they were used for. Reilly says the ones in question are more mechanically complex and are used to explore bile ducts and pancreas problems than the general scopes implemented during routine endoscopy procedures and colonoscopies.
And there is a big difference in the type of equipment utilized. Even though from a patient perspective they're very similar in the fact that they both go through the mouth, they're a very different type of equipment.
Both kinds of scopes are non-disposable, and because they're electronic, they can't be sterilized, only processed and disinfected. Matt Miller was the first certified endoscopic processor in the region.
A lot of people are trained just by somebody who's been trained by somebody who's been trained.
Miller took classes to learn how to clean all kinds of scopes to above industry standards.
It's something that is inside of you. Of course we want that to be as clean as possible. We don't want any contamination. There's no reason anybody should have to even consider that or even worry about that.
Right after a procedure, scopes are manually wiped down.
And we test it for any leaks, which is a huge concern.
Techs scrub the equipment.
The brush is actually run down every single channel at least 3 times, if not more.
Then time in a processor that emits a high-level disinfectant along with 102-degree heat. Then the device soaks in purified water. Reilly says if you ever have any questions about a procedure, ask specific questions.
Don't die of embarrassment, that if you need something done, discuss the risk with it.
Catherine Daniel, Channel 3 News.